it's the collapse, the decimation of our current healthcare system that has led to this very promising development of direct primary care and similar cash pay models, like the Surgical Center of Oklahoma and other places that are saying, hey, we're getting out of this, working for the government, working for insurance companies.
Welcome, everybody, to Conversations That Matter. I'm your host, Alex Newman, for the New American Magazine. We have a very special guest with us today. His name is Dr. Chad Savage. He became dissatisfied with the traditional healthcare, medical, industrial complex and decided to try something different. He's got a very interesting practice. He's Your Choice Direct Care. That's up in Michigan. He works with Samaritan Ministries International. It's a cost-sharing Christian ministry. He's a member himself. And he's doing things a little bit different. Dr. Savage, welcome to the program. Thank you so much for joining us. Tell us, why did you decide to exit kind of the more traditional establishment, corporate, hospital-controlled model and do something different?
Well, I think you just summarized it fairly well. It was a controlled corporate model of medical care. And I was practicing in that for about 12 years in an employed model through our local hospital. And I don't have anything wrong with that hospital system. But the way medical care is designed today, it's intentionally intrusive into the doctor-patient relationship. We were just on the treadmill of productivity, running. The patients didn't have that connection with the physician because in 5 minutes, it's hard to establish that. And it was an unrewarding, unfulfilling practice of medicine. It was definitely not the calling it was intended to be. So I wanted to get off that treadmill and get back to the Marcus Welby form of medical care where you're caring for the patient. You have a relationship with that patient. You can give them the time, perhaps avoid medications and surgeries by helping them to understand the importance of lifestyle modification instead of simply running in, throwing a drug at them and running out the door. So after 12 years of practicing in that model and starting to get burned out on it, I looked desperately to find something to re-justify my calling in the practice of medicine. And I realized that there was a model of care that's a concept of care called direct primary care that was emerging within the United States, which is a membership model. And it's for my practice specifically is $49 to $89 a month for people to get unlimited care with us. And that includes all the visits, all the procedures we do, all the in-office diagnostic testing. We get cash pay meds, labs, and imaging services. And just as an example, we can treat blood pressure with a medication called amlodipine for an entire month for less than 25 cents, which means less than the cost of a gumball. So we can really bend that cost curve. But when I went private, when I moved into this model of care, direct primary care in 2015, I became just like everybody else. I became a healthcare consumer. I had to go out and find my own coverage. And initially, when I started looking at the ACA, the Obamacare exchanges, I was aghast. We were talking $26,000 a year to cover my family of four, and that was back in 2015. And so I started desperately looking for other ways to cover for the catastrophic episodes of care. So most care is able to be provided out of these direct primary care offices. About 80% of medical care can be provided out of that. So you need coverage for that rare event that puts you in the hospital. The concept of traditional insurance. Well, insurance in the medical care in the medical industry is no longer the concept of hedging against catastrophic financial loss. In many ways, it is the catastrophic financial loss. So I heard about health sharing ministries and I started looking around at them, and there's a number of them out there. They were newer at that stage. They took off after Obamacare when everybody was kind of making the same conclusions that I was. And I found one called Samaritan Ministries, which has absolutely been an amazingly good experience. It's a Christian-based organization that goes off of biblical principles of sharing each other's needs as extolled in Galatians. And what happened is over that first 5 years, I ended up writing an article on townhall.com, which is a news website, about my experience in the first 5 years. And over a 5-year period of time, by combining the much more cost-effective health sharing ministry for catastrophic issues and just paying a direct primary care doctor for my own and my family's care directly, we access the doctor as much as we want through direct primary care. And in that 5-year period of time, saved $86,000 over the premium costs I had been quoted for the Obamacare product. In which case, if I had purchased that insurance product, that was just for the card. That was just for the insurance. I hadn't even seen a doctor at that point. That was just for the honor of having that card in my pocket, which if you think about that over a decade, That's in savings, not in deprivation or rationing of care, in savings on care, enough to buy a modest house. And because in the health sharing ministries, you send it specifically to Samaritan, you send your monthly contribution. It's not a premium. They don't call it a premium like they do in the insurance industry. It's a share. You send your share directly to the person in need. It very much makes it much more personal. You get a sense of almost a charitable giving. You get to pray for these people, and it's not uncommon to get a reply like something like this, a thank you card. Because my children, we actually write in a get well card. We give out the check for their medical need, and it'll say, Bob Jones was recently diagnosed with colon cancer. Will you send your monthly contribution not to us as Samaritan? Send it to Bob Jones, and they track it, make sure it's all being authentically utilized. But they will. My children would write little get well messages in it. Sometimes draw pictures when they were younger and things of that sort. But we actually get thank yous in response to that. And I will tell you, I've never once received a thank you letter from Blue Cross Blue Shield for sending in premium. So I started thinking about that because my premium costs were going to be around $22,000 a year. $2,200 a month. And Samaritan, we currently pay about $650, $680, and then we do an additional contribution for people who have unshared things, the things that aren't covered by that, because a lot of the people in the Samaritan go above and beyond to try to cover each other's needs. And there's in case you have just a ridiculously overwhelming, costly thing, we give a little more money for that too. Anyway, the savings was about $1,600 a month, even when we added in the cost of the health sharing ministry.
Yeah, actually, I'm a proud member of a different Christian cost sharing ministry, and I can't say enough good things about it. It saves us tons of money. I don't have to pay for people's abortions. I don't need to pay for trans surgeries and heroin addictions and things like that. I think that's a much better model. Dr. Savage, we're almost out of time. We just got a few minutes left, but talk a little bit about the difference in your direct care model as opposed to kind of the big insurance and you go to the doctor. I mean, talk about how your practice is different than, say, a hospital or a practice affiliated with a hospital. And I mean, where is this all going? I mean, there seems to be kind of a divergence here between the big corporate model, the government controlled model, and these new alternatives that are popping up and rapidly becoming more popular. So talk a little bit about the difference with yours and where this is all headed.
Well, true innovation never comes from a place of comfort, unfortunately. So it's the collapse, the decimation of our current healthcare system that has led to this very promising development of direct primary care and similar cash pay models, like the Surgical Center of Oklahoma and other places that are saying, hey, we're getting out of this working for the government, working for insurance companies. We need to make it cost effective. We know that we have to do that, but we are thriving in a massively slanted, skewed field. So, the traditional insurances frequently are subsidized by the government. We are having people, my practice is nearly full with patients. We set a cap so we don't see too many patients, so we can give them the 30-minute to 1 hour visits that are regular for our office, and same day, next day kind of visits, where now the average wait time is about 28 days to see a doctor. So the reason we were able to do that is because we got out of the bureaucracy of the third-party system, of the billing, coding, them paying us to incentivize what we do. We're paid more to become data entry clerks, tracking numbers of patients. They penalize you if you order too many MRIs, if you happen to refer outside of this artificial insurance network, et cetera, et cetera. Samaritan Health Ministries, the other sharing ministries, generally speaking, do not have that. I don't know which one you're specifically with, but Christian Healthcare Ministries, MediShare, and the others are all, generally speaking, really good. So the one I'm in is SamaritanMinistries.org is their website. People are certainly welcome to check it out. If they want to learn more about direct primary care, docs4patientcarefoundation.com. That'll tell you about direct primary care, what we're trying to do on that. Again, those two models, better, more cost-effective care combined with less expensive coverage, more Christian-based coverage, is just an amazing combination.
Yeah, no, I agree with you. And, the system, if you will, is just so rotten. And I think that was really exposed clearly over the last few years. Dr. Savage, really appreciate it. Any final websites you want to give out? Any way people can follow you on social media, anything like that?
Sure. So I don't have a designated page or anything like that, but I'm active in Twitter and Facebook, and people can certainly type in Chad Savage MD into those, and I'm sure I'll pop up. Also, just wanted to make people aware of one other thing. There's healthcare sharing. The Healthcare Sharing Accreditation Board is a new board that has been made to try to ensure that when people engage in health sharing, they don't get a fraudulent one. The sad truth is, in recent years, there's been a lot of copycats out there realizing that they can defraud people. And so you do need to be an educated consumer, make sure you're getting a valid product. And that's one way of doing so.
Excellent. Dr. Chad Savage, thank you very much for joining us today. Thank you for what you're doing. Please keep us updated. Hopefully we'll get you back soon.
Sure. Thanks, Alex.
All right. Thanks, folks. All right, folks. Alex Newman here with Conversations That Matter. Thank you for joining us. Until next time, God bless you all.
Sophia paused before the door. It read, Department of Bidigital Convergence. Just inside was a new world, a better world, the one of everlasting life, of no pain, of no loss, of no problem. She entered the chamber and her surroundings changed. She saw around her an infinite field of waving golden grain surmounted by cloudless blue sky. The AI voice whispered gently in her mind, Welcome to the singularity. She couldn't see it and couldn't feel it, but her body had almost instantly been covered by a swarm of tiny gray multi-legged bots that melted through her clothes and into her skin. Not perceiving the nightmare, her eyes had already been consumed and the rest of her body was dissolving as the bots digested her flesh. She felt only a warmth suffusing her being. Drowsy, she drifted to sleep, and her last thought was one of panic. Would she ever wake? Could a nightmare vision like this be an outcome of the much-hyped transhumanist technological singularity? Enter the world of the future as illuminated by the experience of the past in Endgame, the new book by Dennis Barrett, the publisher of the New American Magazine, and find out how the disastrous COVID pandemic response fits with the technocratic elite's thirst to create a transhumanist utopia. Get Endgame from shopjbs.org with free shipping with code ENDSHIP, ENDSHIP. Or get Endgame and the Great Reset Collector's issue of the New American Magazine and get free shipping plus an additional 20% off both with code N20, END20.